Okay, so if you set, if it is already 100%, that means you are going to produce continuous ultrasound going inside. Okay, you call it as continuous mode.
Just for continuous.
If it is, when you will use continuous mode? When you set continuous mode, duty cycle is 100%, that means it denotes chronic. Okay, so that's what think logical. So if you set the duty cycle 100%, that means you are going to treat the chronic, subacute or chronic. Okay, if you want to treat acute and I want 1:4 ratio, Mafi 100%, I want pulse mode, what I do? So change to 20%, that means 1:4 ratio, 1 second ultrasound go inside, 4 second rest. Okay, so ultimately you get into the ratio of 1:4. 1:4, 20%. This is the minimum. So if you have changing this, the duty cycle to 20%, then it denotes you are going to treat pulse mode. Pulse mode for acute conditions. Okay, so that is very important. So pulse mode for acute 1:4. This is ratio. If I want 1:4, what I can do? I can go for 30%. It's 1:4. Or I want 1:1. That means 50%. 1:1. 1 second ultrasound, 1 second off. So that is 1:1, 50%. Mafi 100%. Okay, so you can decide. These are all the ratios. You can set different ratios: 50, 60, 70, 80, up to 90 you can go. Okay, so this 100 is continuous. Okay, but up to 90, when you change from 100 to any other decimal, 90, 80, 60, 70, that means it denotes pulse mode. You treat for acute conditions. If you set for 100, that means for subacute and chronic, whatever it is. Okay, so this is how you want to set the duty cycle or the percentage of ultrasound which is going inside the body tissue. Okay, so this you call it as duty cycle. Then I want to set the time. What is the treatment time? How I set? Good, press F6. Then what is the treatment time? Suppose if the condition is chronic and I am keeping, this is rough rule. Okay, if the condition is chronic and I want to give more intensity, zyada, Mafi 8, I want to give, wait, where is it? I want to change this to 1.5 or 1.5 or maybe 2. Okay, it is chronic. So now the intensity is more.
Aggressive.
Yeah, intensity is more aggressive, and it is continuous. Duty cycle is continuous. So how much time can I set here?
15. Half time. 10 minutes.
Maybe 7 to 8 minutes or 8 to 10. That is the maximum.
What?
That is the maximum because it is continuous and the intensity is zyada.
So I make less time.
Yes. Okay. So whenever you decide, if you are going to give, increase the intensity, reduce the time. It's inversely proportional. Keep that in mind. That is rough rule. Okay. So if you are going to increase the intensity and placing it in continuous mode, try to give less time ultrasound. Okay. Maximum you can go up to 8 or 10. That's it, the maximum. Some books say 6. Some books say 8. Okay. So you can keep an average 6 to 8 or 8 to 10. That is the maximum treatment time if you are increasing the intensity. Okay. Suppose I don't want chronic, I am treating acute. Okay. I am treating acute and I am reducing the intensity, maybe 0.5. Okay. Subacute or acute. Okay, whatever it is, 0.5 I am giving. Okay. So what is the time I am going to set now? And duty cycle, wait, duty cycle I am changing. I am giving only
Subacute.
say 50. Okay, so what time I can set here?
Subacute or acute?
13.
Subacute or acute, whatever it is.
30 minutes.
10 minutes.
30 minutes. 30 minutes.
Why 3 minutes? The intensity is zyada or kam?
How much time is maximum?
Intensity is zyada kam?
0.5.
0.5. Zyada kam?
3. 10 to...
It's more or less? I am asking. The intensity is more? Less. Intensity is less. What is the duty cycle? Percentage of energy going inside?
Less.
Less. So what can I do
More
for
time.
more
More
time?
time.
Exactly.
So I say 30 minutes.
20.
Okay, so you can go up to 10 to 15 minutes. 10 minimum, maximum 15. 10 minimum, maximum 15. Okay, so you increase the time. That is the rough rule. Okay, if you are doing with less intensity, less percentage of energy going inside, that is duty cycle, then increase the time. Minimum 50, maximum 15. Minimum 10 minutes, maximum 15 minutes. Okay, so clear with this? So this is the main setting you have to do, depending upon the patient.
Okay, I can choose. How can I choose time? There is a rule or something like this.
So that's what I said, no, there is no definite rule. So in the last lectures, last slides, maybe some 10 or 12 slides, you have been given the standard treatment time, okay, for soft tissue treatment, contracture, okay, like this. So in that, there is what is intensity you are supposed to use and what is the time you are going to treat. It's everything mentioned there.
But soft tissue,
Okay,
they can
not phonoporosis.
treat inhalation.
Here, plantar rod. Okay, so what is the time or here? Okay, so this is the intensity. This is the time. 4 minutes into 4 weeks. 4 times this frequency. How much time? 5 minutes. Okay, so
5 minutes. You say here 15.
I say it's depending upon this thing. It can vary depending upon the condition. For this condition, it is for bone healing. I am not saying it's for bone healing. I am just generally saying. Okay, generally. So when you come to use this for particular condition, then you will try to know what is the intensity to set. Okay, just general, you know how to operate the mechanism. That's it. Okay. Any doubts in this? Any doubts till now? I am ready to explain again. Okay. So once everything is set, see here it's always in stop mode. Okay. Then you apply gel. Suppose he is the patient. Okay. So provide him as a good support. Elbow joint I want to treat. Here, that is, what is here? This area you call it as
Elbow?
elbow joint. Joint is here, but this area, what is this area? Muscle? Anything?
muscle.
No,
What is here?
Insertion.
What is the muscle is originating or inserting?
Biceps.
No.
Triceps here, triceps here.
Humor ulnaris.
All extensor group of muscles. Okay. All extensor group of muscles originating here. So common extensor origin. Okay. So this you call it as a tennis elbow. The condition. Okay. Tennis elbow, that is usually they play tennis. Okay, or use the upper limb more. Okay, that is extensor. This type of stroke, backhand stroke. You call this one backhand stroke. Okay. If they use frequently more, then here they may get inflammation. Okay, at the common extensor origin. That type of condition you call it as tennis elbow joint. Okay, usually extensor carpi radial is longest and brevis, the specific muscle group. Okay, so if I want to treat this, then I will position in a, which position you will select? Sitting, position.
Stabilize a bit.
Position the patient now for elbow joint, right side. Whatever it is, you select. Don't tell me, select. What you want, select. Everything is positioned here. Arm rest, without arm rest, back rest.
Elbow joint?
This area.
Yes. Give him comfortable position. Tell us.
Yes.
Okay? Right. How will you treat? Treat. That's what, position properly. So where you want to make change, everything you make change. Do it.
I have to
No, just do it. Is right? Is right, or is doing anything mistake?
It's no.
I have not.
Why?
I should
Good.
take a chair.
Exactly, take care. So Mafi, stand and do. Okay, whenever you are dealing with ultrasound, if you are able to give 10 minutes or 15 minutes, Mafi, stand and give. If you stand and give, you have to bend your back it will hurt your back. So not proper biomechanics. Okay, galat biomechanics. Simple. That's what common sense. Use your common sense, brain.
No, my point is that all was wrong.
Sit. Okay. So you keep sitting position which is comfortable. Okay. You are close to the machine, close to the patient. Right. Then in this also, patient I feel may not be comfortable. Okay. What you can do instead of that, to make him breathing good, you can give some pillows down. Take one or two pillows. One or two. Pillow. One. If he is comfortable with that, more comfortable, then leave it. If he is not comfortable, try to give one more pillow. Okay. So why is I am relaxing more? Because I am decreasing the distance between the shoulder and the armrest. Here, if you see, there is more dragging. Okay. It's more dragging. So this, if you give some support, it will become much more relaxed. Okay. So always try to maintain the kanun. Kanun is comfortableness. If the patient is 100% comfortable, the treatment will be 100% success. More faida, more benefit. Patient will respond to your treatment. Otherwise, mafi respond, mafi decrease in pain or symptoms. Okay. So then you take the head. Before start, what do you do?
Check what test.
Testing you done, finish. Before doing it, now you position the patient. Therapist is ready. You set the setting now. Suppose say acute only. He is going to set for acute. Okay. I am giving you the condition. Okay. So now the patient is acute. Okay. Set acute. You on the machine and you do it.
Switch on from here.
Good. Switch on. Patient acute. Okay. Set for 1:1 ratio duty cycle and intensity 0.5.
.4
1:1 ratio. I want 1:1 ratio.
1:1 50. How much work?
Yeah, 1:1 50%. Yes.
Acute maximum.
Maximum 3. Maximum 3. Okay. Then time.
Time. 15.
Minimum 10, maximum 15. So start with minimum. Okay. Right. Then start. Correct.
No contact. I have to put gel.
So no contact. What is here? No contact.
Ultrasonic gel.
You have gel and
Ultrasonic gel. And again, machine is also not on. So no contact. Leave it. No problem now. But what you do now? You said now. What you do?
Nice.
some gel.
What next? Nothing next. You have to start. But don't start now. Why? If I start,
No contact.
What is the next?
what wrong? Why? Why I have to put it in skin?
The current is fast. So it's coming out.
Don't say current, it's sound. Ultrasound. Because once you switch on, the ultrasound produced will come through this coaxial cable, it will be coming out. But when you position in the air, what happens? It's reflection back. 99.9% go back again. What is 100% produced outside, going back again. It will damage crystal. Okay, so that is carbon, the head. So you don't want that. So what you do? You put gel here as well as the treatment area. Sit comfortably. Okay. And if you want, you can provide some towel down there, because whenever you are going to deal with here this area, some of the gel may come down and it will spoil the pillow. Yeah, towel. You can have some towel. Okay. Yes. Right. So you put some gel here. and also the patient skin. Okay, put it liberally. Okay. Okay, right. So once you start, listen. Which is your dominant hand?
This.
So how are going to manipulate the system?
Fine.
So again you are crossing.
Okay.
Okay. So how what these and all you have to think, all common sense. Mafi kanun. Okay. So make sure, come this side.
Okay.
Come this side. Take the chair. Let the patient position like this. Okay. Take the chair to see. Good. Okay. So use your brain. Mafi brain, mafi faida. Okay. Right. All simple thing. Simple logic. Very easy. So it's your dominant hand is going to do. Then I can easily manipulate the button machine. Okay. Start. Okay. Start now. But again it gives sound. That means what? Mafi contact. Okay.
I have to bring that.
You have to maintain some pressure,
Okay.
firm contact. But again it still gives sound. Okay.
Okay.
Mafi contact موجود.
ايوه شدها هذا ما نحضر انت
Okay. If it is in back or if there is more muscle or maybe you have to give some more gel. Okay, more gel. Okay, more gel, then there will not be any sound. Okay, but the area is small. If you give more more gel, it will fall down. It will come down. Okay, we'll just see now practical. You just try to do it like this. Firm contact, that is pressure, and circle.
Okay, what is the give? Give what is give?
If I give intensity more, he will feel heat. If I am not moving.
No.
If I am not moving, he will feel heat. If I try to listen what I am saying. If I increase the intensity and I am not moving the head, he will feel more pain or discomfort down the ultrasound. Why? Because periosteal burn, or you call it as cavitation problem. Okay?
Deep bone.
Yes, bone. Now he will not feel anything because it is pulse mode. Again, duty cycle is very less. So he will not feel anything, or he may feel very less heat. Okay, and you are going to treat only 10 minutes. Okay, and the energy or percentage is less. See the properties of gel. See properties of gel. Listen, when you are dealing with this, see it is still consistency is good. Mafi running off. Okay, so that shows it is good property, conducting medium. So all energy produced here go inside. Okay, if this go out, come up water, then Mafi good medium, Mafi good conducting medium, penetration or transmission of ultrasound less. Okay, so that is the quality or property of gel. Again, it is Mafi stain, no stain, good, and it will not rust your metal plate. Mafi carbon, that metal. Okay, so that is the properties of gel. Okay, so I have to do movement because the two things. Why? I have to produce movement, circle movement or transverse or figure of 8, the three types of strokes I told. Why?
Treat all the area. And prevent
Take the button. Why?
treat all the area and prevent bone.
To prevent the burn. So to cover all the area, okay, to cover all the area and prevent the periosteal burn. And one more thing is effective radiating area is smaller than the size of the head. Okay, size of the head is 5 cm, but the crystal inside mojud less. So where is the maximum intensity is concentrating? At the center. Okay, so that you have to cover all the area. So that's what you are calculating. You want some more? Okay. So now again the area or where you have treated is also, it doesn't make any rash, skin disease or make any problem in the skin. So that is the property of gel. Okay.
We have
See after, wait 1 minute. After after treatment of 10 minutes or 15 minutes, whatever it is, if you see the area, you may see some redness. Why? Because of heat. So what the heat? Faida of heat. Increased vasodilation, increased blood supply, nutrition, oxygen, all these things. Okay? So increased extensibility, collagen, fibroblast, production, everything. All faida of ultrasound is going to be there. So once the treatment is on, stop, go to menu, switch off.
Say goodbye.
Say goodbye, yes.
Victor,
Yes.